Welcome everyone to today's Explainer. We're looking at a disease that, honestly, is just incredibly misunderstood. Most of us have probably heard the name, whooping cough or pertussis. We kind of know it's a childhood disease, right? But very few of us actually understand how stealthy, how deceptive, and how incredibly persistent this illness truly is. It's really an ancient adversary that is still out there today, literally hiding in plain sight. There is this quote that really hits the nail on the head. Many parents think they would immediately recognize whooping cough, but the truth is, the disease often spreads before anyone realizes what is happening. And that right there is the ultimate danger of whooping cough. It doesn't announce itself with some dramatic, terrifying set of symptoms right out of the gate. By the time you actually hear that famous, severe cough, the infection has probably been spreading completely under the radar for days or even weeks. Okay, let's dive into this first part, the stealth phase, and exactly how the disease spreads unnoticed. It really is a mild beginning with some incredibly serious consequences. The wildest part about whooping cough? At first, it looks absolutely harmless. A child might seem just a little tired, maybe they have a slight runny nose. It creates this dangerous false sense of security because, well, it looks exactly like an ordinary everyday cold. Those initial symptoms are so incredibly deceptive. We're talking a runny nose, some mild coughing, maybe a super low fever, or honestly, no fever at all. And here's the real issue. During this early phase, the person is highly contagious because they don't seem very sick. They go to school, they head into work, they visit family, and they just easily pass the infection to others, completely unaware of the chain reaction they're kicking off. And here is a massive piece of the puzzle. Adults can spread it too. We often get whooping cough, but because our airways are larger, we might just experience a cough that kind of lingers for a few weeks. We brush it off, right? We think, oh, it's just my allergies or maybe just a touch of bronchitis. Meanwhile, we are unknowingly carrying and spreading the Bordetella pertussis bacteria to the vulnerable people around us. Outbreaks actually happen even in highly vaccinated areas, precisely because of these unrecognized adult spreaders. Moving on to the next piece of this, the microscopic sabotage, or what actually happens inside the airways. To really grasp how it sabotages us, we have to look closely at our body's own natural defense system. Our airways are lined with these tiny, protective structures called cilia. Picture them as microscopic little hairs. Their entire job is to constantly sweep back and forth, moving mucus up and out, basically keeping our lungs clean and clear. But the pertussis bacteria? They are incredibly specialized to ruin this system. It happens in 3 steps. Step 1, the bacteria enter the airways and attach themselves directly to those protective cilia. Step 2, they release toxins that aggressively damage and paralyze that whole sweeping system. And step 3, which is honestly the most fascinating and terrifying part, they send constant, relentless signals to the cough center in your brain. So whooping cough isn't just a lung problem. It is literally a hijacking of your nervous system's cough reflex. Because your nervous system basically gets hijacked, your cough reflex becomes wildly sensitive. Historically, whooping cough has been called the 100-day cough. And it makes sense, right? Because even after your immune system or antibiotics have completely cleared all the bacteria out of your body, that neural damage is still there. That famous violent cough can just continue for weeks or even months, while your body slowly tries to repair the damage to the cilia and reset that hypersensitive cough reflex. All right, let's talk about prevention. Section 3 is all about reframing the vaccine protection against severity. So you might be wondering, if vaccinated kids can still get whooping cough, what is the actual point of the vaccine? It's a totally fair question, but it comes from a slight misunderstanding of what the vaccine is really designed to do. The main goal isn't necessarily to act as a magical, impenetrable shield against ever catching the bacteria. The absolute primary goal is to prevent severe disease, dangerous complications, and death. Vaccinated folks might still catch it, especially years later as immunity naturally wanes, but the illness is almost always significantly milder. The difference in severity can be absolutely night and day. Look at this stark contrast. For a healthy older child or an adult, especially if they've been vaccinated in the past, whooping cough might literally just be a long-lasting, super annoying cough. But for a newborn baby, especially in those first few months of life before they're fully vaccinated, it can rapidly turn into a serious, life-threatening illness. This is exactly why protecting babies relies so heavily on what we call cocooning, making sure parents, grandparents, and caregivers are vaccinated so they don't accidentally bring the bacteria into the house. And that brilliantly illustrates what we need to watch for. Let's get into spotting the signs and exactly what parents need to look for. Here is how the timeline usually plays out. For that first week or two, like we mentioned, it's just a basic, mild respiratory infection. But as we move into the later weeks, the cough totally transforms. It becomes stronger, much more aggressive. The child will start having these repeated coughing attacks. During these fits, you might see their face turn bright red, their eyes water, and they may desperately struggle to just pull in a normal breath afterward. The sheer force of the coughing is so intense that sometimes it's even followed by vomiting. But here is a massive clue for parents and caregivers to keep in mind. Kids usually seem completely normal in between these coughing attacks. With something like pneumonia, a kid is going to feel awful all day, lethargic, constantly feverish. But with whooping cough, a child might be playing, talking, running around, acting totally fine, right up until the next sudden coughing fit seizes them. It's this very distinct rhythmic pattern of completely normal behavior suddenly punctuated by these severe attacks. Okay, so what do we do if it happens? Let's talk about practical care and recovery and managing symptoms at home. Once you've got antibiotics going, which is absolutely vital for stopping the spread, even though it won't magically stop the cough overnight, caregivers need some practical game plans. Since the cough reflex is just so hypersensitive, there's no magic medicine to switch it off, but these simple environmental controls are incredibly effective. Give them lots of fresh air. Use cool and humid air because warm, dry rooms actually trigger more coughing. And above all, maintain a super calm environment. Fear and stress can actually make the coughing worse. So when an attack happens, stay calm, help the child sit upright, get them some fresh air, and just provide calm reassurance. I really want to wrap up by leaving you with this thought. A disease doesn't just disappear because we stop seeing it every day. Before vaccines, whooping cough was a devastatingly common tragedy. Today, we rarely see it at its absolute worst, which ironically makes us underestimate it. But it is still here, hiding in mild colds and lingering coughs. Understanding this hidden enemy isn't just about protecting ourselves. It's about making really informed decisions for the generations of people who depend on us. So ask yourself, are we doing enough to protect the most vulnerable among us? Thanks for hanging out with me for this explainer, and remember to always keep asking the right questions.